Hi, I'm AJ. Welcome to your Zip Up Activation Prep. This is a focus on your pelvic floor. This happens before the breathography fundamentals, so we can take time within our first aid program focusing on contraction, connection with the pelvic floor. Very challenging to feel, especially after giving birth. So a lot of this program is about visualizing areas of the pelvic floor, because with visualization you will get small amounts of contraction. This is supported by research. So don't be discouraged if you're not feeling that pelvic floor initially. I want you to go through these motions, and I want this visualization pattern to become second nature, organic, because we're going to use this specific visualized pelvic floor contraction to preface every single one of our movements in the first aid program, and even moving into the 52-week program. So with the pelvic floor contraction, there's many ways to approach this, and optimally see a pelvic floor physical therapist after you give birth. That's going to optimize your program and really individualize this for you. This is a method that I've created that's worked very well for my postnatal clients, and even for all of my clients. I include pelvic floor work because it's not only postnatal women who need the pelvic floor strength, but because we have experienced the trauma, the beautiful trauma of giving birth, we need to focus on restoring that. We need that physical therapy. We need that attention to the pelvic floor. And so if you can please start in a seated position so that you can feel the connection between the pelvic floor and the seat. If you have a physio ball, that spherical round surface, even better. Sitting on that surface so that you can make that connection between the pelvic floor and that proprioception, or that feedback as to what the pressure is like between the pelvic floor and your seat. That is absolutely optimal. So again, if you have acute pain, if you've had a specific situation where you need extra help, please again see a pelvic floor physical therapist. Adding in these routines when there's no acute pain, and just as a method of increasing activation and awareness of the pelvic floor, combining this with all of your functional movements and getting this contraction as you bend over to pick up your baby, as you're pushing your stroller around, all the things that we're asked to do and are demanded of us immediately after giving birth. And so it is a bit silly that the doctors say, wait 6 weeks to go back to exercise. Yes, intense exercise, but let's start breathing and let's start visualizing contractions of those muscles that were challenged when giving birth immediately. So before we go into the breathography fundamentals, we are simply going to isolate and focus on my visualized pattern of getting a good pelvic floor contraction. So here in the seated position, widen your legs a little bit. I want you to equally weight yourself on your two sit bones. Press yourself back gently against a wall, or if you don't have a wall and you can't push the chair against the wall, just be on a kitchen chair, something that gives you feedback as to where the posture points are in space. The reason for that is you're going to optimize your pelvic floor contraction if you have good posture. So if your head is stacked over your ribs and your ribs are stacked over your pelvis, you're going to more successfully activate that pelvic floor, and you're just going to have better body mechanics in general as you progress back up to your normal exercise routine. So press your head gently back, press your ribs back, and equally weight yourself between the two sit bones. That's it. We're not going to add the entirety of the zip up activation, which involves focusing on all posture points, because today I want you to zone in and focus on connecting to that pelvic floor. So to begin, I want you to make a number 1 with your index finger. That is representative of the pelvic floor muscles that move front to back. I want you to imagine that number 1 that you're making is sitting between your pubic bone and your tailbone. Okay, so visualize that space, even close your eyes. That's your number 1. So you have pubic bone, you have tailbone. Now I want you to pull those 2 points on the number 1 together and release. That's your number 1. Together and release. So we're moving in this direction. It's called the sagittal plane. So it's front to back and release. Front to back and release. Now I want you to make a second visualization. I want you to imagine that there is a fisherman or a fisherwoman standing on your tailbone. Okay, so they have their fishing line and their fishing rod, rather. You can tell that I'm not a professional fisherman. And they're standing on the tailbone, and then they cast the line out to the pubic bone right in the front here. Okay, you can even touch. Okay, they reel it in toward the back. So you're pulling more front to back than back to front. Okay, so it kind of looks like this. It's like the front is coming toward the back, but sometimes it's just easier to think, pull these 2 points together like this. So pull together, release. You're pulling that fish into the boat, release, front to back and release, front to back and release. So ultimately what you're doing is you're contracting the muscles that surround the urethra. So it's like you're stopping your urine, you're stopping your pee. And the reason that I focus more on drawing back versus drawing from back to front is that it's harder to feel those tiny muscles in the front that stop your pee than it is those bigger muscles in the back, the levator ani, the sphincter muscles that control the poo. Okay, so we're going to get down and dirty today because these are the muscles that control peeing, vaginal wall, and pooing, right? So this is what we want to focus on. So again, this way, it's a little more front to back. You're drawing in. You're drawing back. You're drawing back. You can say, don't pee, release. But you're also getting a little contraction in the back as well, because many of us have lightly torn or maybe majorly torn even into the anus. And so we also need to restore those muscles. It's just that, again, it's easier to feel those muscles in the back than it is in the front. So again, I want you to think drawing back. You're reeling it in. You're reeling it into the back. And you should feel that pelvic floor gently pulling away from the chair also as you think don't pee. Okay, so that's number one. Your number one is pulling front to back, front to back. Number two, you're making a perpendicular line on that number one. So ultimately you're creating a plus sign, right? So the number two is in this direction. Simply, you're pulling your sit bones together, release, but with your butt, your glute muscles released, and your inner thigh muscles released. So put your hands on your inner thighs, pull the sit bones together, release. Are they relaxed? Are your legs melting down into the ground? Together, release. Together and release, right? So feel the weight of your sit bones on the chair and try to draw them together. And don't worry, if you can't feel it, just close your eyes and visualize it. You're pulling together and release, together and release, together and release, together and release. Now, the reason I separate those two components, and yes, there is some redundancy because you're just going to continue to contract the pelvic floor. And if all you can think is squeeze in my pelvic floor, I can't feel anything anyway. I just want you to visualize that plus sign, and eventually you'll start to feel an extra contraction in this direction. And that's because the whole pelvic floor basket, or the pelvic floor diaphragm, really is like a basket. And we have many muscles moving in many different directions. You know, some are more in this direction or like a little on an oblique angle, and some really are almost directly in that perpendicular angle, like our transverse perineal muscles that pull together in this direction. And just taking an extra beat, an extra moment to get an additional contraction, aiming for a more horizontal contraction, it's only going to deepen the blood flow in that area, the healing in that area, and that contraction and that awareness in that area. So number one, reeling it in, pulling back this way. Number two, pulling in together this way. That's 1 and 2. Let's practice. Close your eyes, push your head back against the wall. Let's go number one. Number one. Number two, sit bones together. Hold 4, 3, 2, 1. Everything releases. And again, number one, pubic bone to tailbone. Number two, sit bones pull together. Hold 4, 3, 2, 1, and release. Take it again. This way. Horizontal. Sit bones together, hold 4, 3, 2, 1, and release. One more time. Pubic bone to tailbone. Sit bones together, hold 4, 3, 2, 1, and release. Now, there is a number 3. I'm not going to go beyond number 3 today, I promise, just so that we can keep this as simple as possible to get this focus on this pelvic. And I don't want you to move on to the next video until you feel strong in your visualization, maybe even a little bit of connection here with this direction and this direction. Now, number 3 is simply taking the elevator up 2 floors. So you're pulling that plus sign together, right? So you've created a plus sign. You've pulled that plus sign together to the center of the plus sign, and then you're taking that contraction and you're taking the elevator up 2 levels. A common analogy in the pelvic floor physical therapy world is you're sucking a marble up. You're drinking a milkshake through your vagina. You're pulling it up into your cervix. You're holding a pee in and you're lifting the pee up towards your navel. All of those things works. Whatever works for you, great. I like the elevator analogy because you've just pulled that plus sign together on 1 and 2, and now on 3, you're just gonna lift it up just a couple of floors, right? And the reason I like the elevator analogy is because eventually when we go to the breathography fundamentals, where we take it through the entire zip up activation, the next count is gently drawing the navel in. So you've pulled that elevator up, and then that heads toward the navel, which is about like the 4th floor, right? So if you imagine that plus sign getting pulled up to the 2nd floor is about here, then that 4th floor is then pulling that pelvic floor up into the navel, which is what is going to loosen the ab ribbon around the waist. Now, if you don't have an ab ribbon yet, totally fine, because we're just focusing on that pelvic floor contraction. Many of you, if you have had a C-section or even, directly after birth practicing these movements, you're not quite ready to get an intense contraction in the transverse abdominis. We're just focusing on bringing awareness to the pelvic floor, okay? So let's go. Number 1. Number 2, sit bones. Number 3, let's pull that elevator up and hold for 4 beats. 3, 2, 1, and then everything releases. Close your eyes. Just listen to my cueing. Press your head back, press your ribs back. Think about those points staying connected as the rest of the body is still. The only moving variable is your pelvic floor. Let's go. And number 1, pull together. Number 2, sit bones together. Number 3, elevator up to the 2nd floor. Pull that plus sign up. Hold 2, 3, 4. Everything releases. Let's take it again. And pubic bone to tailbone. Sit bones together. Elevator up. 4, 3, 2, 1. Everything releases. Take it again. Pubic bone to tailbone. Sit bones together. Up the elevator 2 floors. 1, 2, 3, 4, and release. Now, I want to practice this just one more time. We're going to go 4 times in a row, and I want you to gently inhale through your nostrils, and on your exhale, you're going to exhale on a hiss. Very gently, not forced and engaged like we do in some of the other HYPOXIX workouts, where you're getting that high intensity engaged exhale to get the obliques in there. We don't want that right now. We're not ready for that yet. I just want you to gently exhale, which is going to calm your nervous system, by the way. So very therapeutic. And then use that exhale to increase that contraction of the pelvic floor, because a pelvic floor contraction does work in tandem and correspond with our exhalation, right? So if you exhale and you time it with an exhalation using our hissing sound to just gently increase activity of that core and strengthen our respiratory muscles, you are going to make progress, I promise. And when we go to that whole zip up activation, we're going to hiss as well. So this is a hissing preparation for the entire zip up activation. So close your eyes, take an inhale through the nostrils, and number 1, tss, number 2, tss, number 3, elevator, tss, hold 4, 3, 2, 1, inhale through the nostrils, hiss. Horizontal, elevator up, 4, 3, 2, 1, and inhale, release. The pelvic floor releases in between, by the way, and that is incredibly important. It's just as important to be able to relax the pelvic floor as it is to be able to contract the pelvic floor. So feel that pelvic floor gently release on the seat below you. Don't bear down, so don't try to push it down into the chair. Just let it relax. Close your eyes, inhale, and hiss. Pull together, front to back, hiss, horizontal, don't let the pelvis move, elevator up, 4, 3, 2, 1, and release. Inhale, and hiss, hiss, elevator up, 4, 3, 2, 1, and release. And you're finished, mama.